everyone for your attention and for joining us again after the lovely tea. So Anusha and I have been co-chairing the Clinical Care Working Group this year, and it's my pleasure to provide you with a summary on what's been going on. Just like to firstly introduce our working group members. We fortunately built a little bit more over time, but I think we still need more people, because I think, as has been said over and over again, we are all clinicians at heart, and I think one of the primary aims of our institute is to bring mental health care to all those who are suffering and the clinical, and try and address that huge treatment gap in mental health care. And whilst research, policy and advocacy, education and training and all are equally important to support the clinician, we do need all the clinicians' inputs, because you're all doing wonderful work out there. You have, good ideas. You've kind of made plans to try and reach your communities. And if you could share some of that with us on our platform, we could maybe learn from you and extend our clinical program even better. So I'd just like to acknowledge everyone on this group: Analuka, Teshome, Tigest, Lishle, Emmanuel, and Michelle. Michelle is part of our collaboration with the Sleep Society as well. And also, we cannot do any of this work without Sinead and Ste, who are actually the backbone and really do most of the work. I'm not sure why we're presenting. I think they have a better idea of what's going on in the working groups than we do. So in terms of the objectives or goals of the clinical working group, we were hoping to, and are trying to still continue to explore innovative ways of addressing clinical care concerns, needs, and training. And we've tried to and be as inclusive as possible in terms of trying to include anyone who's interested in mental health care. It doesn't have to be a psychiatrist or a psychologist or OT. Even your nurse in the community, a doctor who's working out there alone. We would really like to try and reach those individuals. So really appreciate it if others who may have links and associations with other groups or associations that are doing work out there, we are more than happy to collaborate. And that brings us to our second objective, which is to partner with the existing organizations or groups to facilitate a sharing of resources in this area. So in terms of our goals, we previously focused on trying to produce not webinars, but we tried to produce content that we put on our resource hub, which we shared in terms of, our main focus at that point had been neurocognitive disorders, and we have a series that we produced for EMG guidance on this, and it is currently still available on our resource hub. For 2024, we thought we would shift our focus a little bit, and we initiated clinical case presentations in the African Context webinar series. We produced 2 webinars thus far for 2024. It was on perinatal mental health illness, a little bit of bias because the chairs and Michelle are all child psychiatrists. So I think our mind tends to go that route. And then obviously, because we also had the collaboration with the Sleep Society, South African Sleep Association, we also did a webinar with them. And I understand that the perinatal mental health illness group really went very well. We had a very good turnout, despite having, I think, a electricity issue in Durban, load shedding, but anyway, we got through it. And now we've been collaborating with Michelle to try and put our heads together and plan future webinars. And as Michelle has pointed out, the next webinar is going to be on substance use in January, I think. In terms of goal 2, as I've said to you, we've been working with SASH, and we now have a formal agreement or MOU with them, and you are able to access all their resources online if you're an AGMHI member. And I think this is quite useful because sleep is a major problem that occurs in many different mental illnesses. And if you could improve the quality of sleep, using basic practical techniques, etc., that may make a big difference. I would really encourage you to go on the site, and this is, what, for example, one of the videos there on sleep hygiene. Then we also have begun a collaboration, more Anisha leading this, on the Royal College of Psychiatrists, collaboration with us. And we've held one Dean's Grand Round webinar thus far. I'm sorry to say again, it's integrating perinatal and infant mental health services in resource-constrained settings. But we're going to move on. We're starting at childhood. We're going to move through the lifespan. So we obviously need more people from different aspects of psychiatry and psychology to take this bias out of our group. We've also begun we've started its early discussion at this point, but a discussion with Children's Memorial Institute collaboration. One of their concepts or ideas is to help with training of child psychiatry in Africa. And we're hoping to try and partner with other African countries and improve on that. We've also begun working with Courage Protection and Child Protection and Empowerment Community Program. This is an online resource which you can access. It has different online resources that you can use as either someone in the community, as a healthcare worker, or someone who wants to do advocacy. And they also provide training. So there are different ways in which we could work with them, and we are just begun the exploration on how to develop a partnership with them as well. What have been our challenges in the past year? I think partly, I know everyone's busy. It's hard to try and find time to add on another thing to your workload. But I would really encourage people to join, as all clinicians at heart. So we need to address the clinical, and you can be part of 2 subgroups or 2 working groups. So you can join education and training and clinical. They're very closely related anyway. So I think we're really hoping to get a broader representation on clinical care topics. Currently, the heavy focus on child and adolescent is noted. And the other area that we've worked on is obviously old age and sleep currently, but we're really wanting to broaden our horizons. Unfortunately, we were working with EMG, but that has fallen down a little bit because EMG has felt that they're not able to continue our online or virtual guideline material due to a lack of input on a variety of topics. So we're going to have to explore other ways of maybe sharing some of these resources. In terms of the way forward, we're hoping to strengthen our collaborations with the Royal College of Psychiatrists to hopefully produce some kind of a clinical mentorship and supervision program. I mean, I think the program that research group is going to describe in terms of the research mentorship has really taken off so well, and we're looking to expand on this for us as well. We're also looking for experts who are wanting to speak or share their expertise. And we're also hoping to engage with countries who have currently not been in the AGMHI group. So hopefully there is going to be more partnerships developed over the next year. And I think we have a few minutes for questions. Also, if you want to ask any thing about how to join, etc. So the question is, do we have our meetings together? So each work group has their own quarterly meeting, which we will generally set up at the beginning of the year so you can diarize them. And we can also try and find times that work for different countries. Okay. Thank you.
Thanks, Saeeda, Professor Paruk. And now we are moving on to Advocacy and Policy, and I'd like to welcome Dr. Siki Gwanya Mdleche to the podium. Thank you very much, Siki.